It's 5:02. We can get started. This is the Town of Littleton Board of Health meeting, February 11th, 5 o'clock. We have a public hearing regarding the Board of Health mask mandate. It's currently in place. To start things off, I guess to start things off, I wanted to just get an idea from the board if there was a motion that we should be considering. Yes, Mike?
Yes, I'd like to present a motion for discussion and subsequent vote after appropriate discussion by the board and by the public who may be interested. May I have your permission to share the document for review?
Sure.
Thank you. Assuming it's still here. Well, it looks like I'll start again. Sorry about that.
All right.
Okay. All right. Take the photo.
You ready?
Sure.
Ready.
Hey, Gino, could you mute your, and we appreciate if you just mute your thing. Can all of you see that? I'm assuming you can.
Yes.
I'll read it for you. This is the proposed text of a motion. This is for discussion and we'll follow the usual rules for good order. The current mandate of indoor masking of all government and other establishments is hereby terminated as of this day, 11:59 p.m. or the next earliest time permitted by law.
Okay.
So before we have any votes or anything, I think we have to proceed through a discussion.
Yeah, well, let's see if there would be a second to this motion before we discuss anything about it.
May I suggest, Mr. Chairman, that before we second anything, that we have a discussion. There may be contributions made either by members of the board, which is their right and their responsibility, and or shall we say creative comments from the public who may be present.
Yeah, of course.
With it. It's just simpler, I think, to gather and make note of what's coming in and then do it that way rather than have something locked in that requires us to go through.
Yeah, why don't we go through some board member comments? We'll start alphabetically here. Dan Kane.
I didn't think I was alphabetical, but sure.
Well, you are by last name.
Okay. One, and my respects to the chair, I do think I need to get this off my chest. I'm a little bit disappointed with the calling of a special meeting for 5 o'clock on a Friday evening while legal 48-hour notice. The timing is concerning for me that it's certainly at a time where most members of our community are unable to, or potentially unable to, at 5 o'clock at the end of close of business on a Friday, to be able to be involved and participatory in this meeting, which certainly is a divisive issue in our community as well as our nation. I'm a little bit disappointed that we decided to call it for this time. I need to get that out there for you to be aware that this is a concern. I have reservations in general. However, I also am a realist, recognizing that the impact of this is going to be probably relatively minimal. We've had challenges enforcing the mask mandate. We have limited health officer resources in our community. Certainly the show boards is wonderful and work very, very hard and do a great job. But certainly as far as consistent presence in our town, they're limited. And our police department our police chief has stated as a designated agent of the board has stated that he and his staff would not provide any level of involvement in the health in the mask mandate, even as far as educationally, never mind citations or further enforcement. We are in a hole of trying to do what we're trying to do was the best we could with the science and data we have based on CDC recommendations and many others. recognizing that without any enforcement mechanism or educational mechanism, it has not been as effective as it probably could have been. Moving forward, I do not see whether we have the mandate in place or not. It's really going to change where we are today as far as compliance, for lack of a better term. Those who will, those who won't and haven't been will continue as they have. I was describing it to someone else as it's baseball. You win a third, you lose a third, and it's those third in the middle that make the difference of whether you're in the World Series or not. We have those folks who do it because it's the right thing to do. We have those who will refuse, no matter what we say, that try to convince them or what science we present won't. And then we have some group in the middle who may not have won it without the mandate, but I have a feeling that middle group is relatively small. So I think the motion as presented is as clear and simple as it can be. I do have a question, certainly to initiate a regulation. It needs to be published, it needs to be voted, it needs to be posted before it can go into effect. I'll be honest, I simply don't know. And this would be a question for town administrator and town council. Does the rescinding of a regulation require posting as well? Again, 5 o'clock on a Friday night, it's hard getting that answer, unfortunately. So I'm not sure if
I know that answer.
Awesome. Thank you.
And do you want to know why I know it?
Because you asked.
Well, no, I didn't. But I want to refer back to 2011 when the then board decided to repeal all the local regulations that mattered. They did not have to. They did not have to post it. You have to post it when you put them in place. You don't have to post it when you take them away.
Right.
So, sorry, I cut you off there.
That's all right. I'm good.
All right. And actually, yeah, you're not alphabetical by last name. I'm sorry. It's Mr. Fratalone. Do you have any comments? You have to unmute yourself.
I think you just gave him a good answer because he didn't know. That's fine. You can post it, but you don't have to take it out. You did the right thing. I'm sure that Mike might have some objection. Never know.
Do you have any comments regarding the motion? Gino?
Okay, oh no, I don't have any. No.
Okay.
Go continue. See what's
Okay.
happening.
Matt Wason.
I thank you, Dan, for the comments you made. I agree with a lot of them. The community has obviously, ideally for a large part, schools included, done a good job in trying to work through the difficulty of managing these things. And I'd like to hope that the future is sunny and bright, but who knows? We're going to stick together as a community and tackle the next problem that comes up to us. Based upon the metrics that I like to look at, I assembled the dashboard and showed at the end of the last meeting. Not that it's formalized yet, but things are looking very good from the criteria I think we should be monitoring. I'm optimistic that it's continuing to move in the right direction. Overall, I think I would support the motion. I agree with Dan in that this is a little sudden and doesn't necessarily get us all the right input, but I also appreciate the community. It's been a long road, and making a change today on the 11th versus the 28th or even the 23rd is a matter of 2 weeks. And scientifically, that's not going to have a noticeable impact, in my opinion.
Okay, thank you. Mr. Zeldin, any comments?
Yes. I appreciate Dan's comments, especially about the, shall we say, the sudden, what appears to be a sudden move to address the issue of the mandate. However, this has been under discussion in one form or another through several meetings. So there's nothing here that I would call new or startling. What I wish to emphasize, and why I'm not only submitted the motion, but supporting it, is because things have really, the environment in which we are has significantly changed. So the things that we used to monitor are no longer as, shall we say, of use to us for what we really want to do, and that is to assist and basically make it possible for the public at large to adhere to reasonable and sensible public health measures. And we're no longer, quote, in an emergency, unquote. We're still in a pandemic. We still have people who are going to be infected and who are infected. We're going to have people in the hospital. We're going to continue to see that for some time, I would presume. And we also are going to see, unfortunately, somewhere, deaths. But we are not in what I would call an emergency state because we have a number of measures that everyone has access to, which is improved masks and how to use them. If people choose to do that, we have vaccines. There is nothing stopping someone, including basically taking care of your family inside your house and considering what would work best for your family and for others around you. These things didn't exist before, especially the vaccine. And I have to also point out this town has done remarkably well, in my view, having toured the establishments. Maybe I'm going into the wrong ones. I'm going to grocery stores, bars, whatever, and just looking to see what people are doing. And they're doing the best they can, including masking. And the best they can, including, if you'll notice, our vaccine rates are very high. And I see no reason for us to continue to, as it were, behave in a manner as if vaccine is not available, improved masking is not available. Awareness is way, way up. So public health is about the public. And I'm hoping here and trusting here, given the activities and the attention given by the public up to date, is that not only will the numbers go where the numbers have to go, but also should fair warning be given to the public that if there are signs of or an existing emergency comes up, that this board will respond, that we will put in place as many good indicators and signals that allow us to do that. And we will do the best we can to give fair warning as well as assurances about where we are and share them as we have in the past. There's going to be, of course, disagreement about any number of these things, but as Dan and Matt have pointed out and others have pointed out, science rules in this case. But don't underestimate the surprise from the virus. So we need to be on our toes. So the purpose of this motion is not to stop people from taking measures, including masking. The idea here is to indicate to please use very good judgment and use all the tools at your disposal for your participation in the community in terms of public health. Thank you, Mr. Chairman.
You're welcome. Thanks, Mike. In my opinion, due to our very high vaccination rate, the cases coming down, the lessening of the severity of the virus, I do feel like we are not in an emergent situation. So I also propose to lift the current mask mandate effective today. I do want to make a recommendation that all citizens wear masks when indoors in public spaces and, do the best they can to continue on the different mitigation strategies. Yes, Matt.
Thank you for saying that. I also kind of wanted to make sure we call out that I think that it is well within the right of any business in our town that if they want people to wear a mask in their space, they should be comfortable posting that and having people respect that decision and just keep carrying your mask around so that you're ready to use it in a situation where it's requested of you.
Yes, and I think everybody just needs to make smart decisions and remain diligent. And we certainly, businesses and different establishments out there can reserve the right to require masks upon entry of their patrons, and they'll make those decisions for themselves. So with that said, we've had so much public input over the past almost 2 years now. We've had a ton of correspondence. If there's anyone out there that has a different opinion or new information out there in the public that would like to speak, now would be the time. We're going to limit the time of the public input to 1 minute per person, and we'll start. Judy, do you see any hands raised?
Yep. Yes, we do. We have one hand raised. Bethany, you may unmute.
Bethany, state your name and your address.
Bethany Keene, can you hear me?
Yes.
Hi, Bethany Keene. I'm Justin's wife, 56 Shaker Lane in Littleton. I also own Woodshed Strength.
Yes, we got a letter from
The
you.
only hand, then sorry to be the only one. And I had a good 2 minutes planned, but I just wanted to, I think most of what I had to say has already been mentioned by some board members. I am asking for the mandate to be lifted. It has impacted our business, as we've tried to make it clear to you before. I did just want to bring us back to September when the mandate was originally put into place, that the primary reasons for that were mostly listed as the vaccination rate in Littleton, which was below 80% at the time, and the fact that children could not at that time be vaccinated. If you listen to that meeting, you'll hear the children cited by the majority of callers in support of the mandate. That was their reasoning. Board members also spoke frequently about the 80% threshold and the younger population not being vaccinated. And just to point out, as you have, that both of those things are no longer true. And the other thing also is just that, again, this was an emergency mandate. There's procedures for creating bylaws in this town, and you're able to circumvent that process by issuing an emergency mandate. And I don't think the board can, in good faith, say that an emergency mandate would be on the table at this time if one was not already in place.
1 minute.
Thank you. So at this time,
You do have one more hand
okay,
raised.
go ahead.
Margot?
Hi, this is Margot Bloomstein. I live on Wilson Lane. As a parent of a child in the school district and in the town who is vaccinated, I'm deeply concerned that we're saying that we have a high vaccination rate. Everybody that wants to be vaccinated can be. And yet just today, Pfizer announced that they're going to be pulling back on their effort to try to fast track vaccinations for kids that are under 5. So we do still have a vulnerable population that has been affected by Omicron that can't yet get vaccinated. Given like the timeline for removing the mask mandate, I'm also concerned about that because I know initially they were saying February 28th, which is right when kids come back from school break. And the last school break, kids were bringing a lot of coronavirus back here. So while we do have a high vaccination rate, and we're doing so well here, I don't know that we're ready to be exposed to what people may be bringing back to here after the February break. I accept that, yeah, it might be good to start thinking about lifting the mask mandate, but do we really want to be so foolhardy to do it this quickly when we're in the middle of flu season, in the middle of a bad cold season, et cetera?
Thank you. Yes, and just to speak to your comment regarding the schools after the vacation week, I don't know if you listened to the school committee meeting, but they are being very conservative, and students will remain masked for a week after school vacation week in February. So appreciate your comments. Judy, do we have any more hands?
No, sir.
So at this point, I will ask if there is a second to the motion or any adjustments to the motion from any board members here. Dan King.
I think I just want to clarify that you had said that they would be, that for our schools, they would be masked returning from February vacation. That I'm not sure necessarily if that is true, because certainly if this motion tonight passes, then any masking in schools ends with the end of the DESE mandate on Monday, February 28th.
Did you attend the school committee meeting last night?
I did not attend the school committee meeting, but I think certainly having some communications with members of the school committee, I I hope that they stick with that.
Yeah, Dr.
I certainly
Clenchey did point out they need time to get things rolling. They are going to have the students be masked until, I believe, March 7th.
Okay, then that's great. And just so folks know, certainly at this point, even if this motion passes this evening for Shaker Lane and Russell Street, under the DESI guidelines, both of those schools will remain masked until that Monday after February vacation, because the DESI mandate still applies to those two schools, middle school and high school. If this motion passes tonight, will be basically at the complete discretion of the school committee and school administration of any and all regulation that they would like to apply or not apply. That would be at the discretion of the school committee and superintendent's office of how they would like to manage any masking in schools after that date.
Yeah, and just for clarity, I know we have school committee members in the audience here. I don't know if you would like them to give you an official recap of what Dr. Clenchey put in place. Okay. But I think they're being very conservative, and I think that the students will be well protected. They've been doing a great job and making great decisions this whole time, and I feel comfortable with that.
Mr. Chairman, can I say something?
Please.
Okay, I understand. The question is, I said that before. If we're gonna lift the mask for the 28, and the children are coming back from vacation, and many of their group got sick, evidently they have to put a mask again. So the motion will be temporarily, we give them a break. But if something really happened and more people get sick, it could happen. So if it did happen, then we have to say, I'm sorry, you have to put a mask on again.
Yes, of course.
Until for
The
another phase.
The pandemic's not over. Well, we are still going to continue to be very diligent and watch the data and follow the science, and
Okay, good.
and do what we need to do when we need to do it. Matt Wason's, we're working together to put together a dashboard with some identifying metrics that will help us make a decision and be informative to community members as to why certain decisions are being made.
Okay, in that case, Mr. Chairman, I second it.
Okay. So we will take a roll call vote. Gino Fratelloni,
Yes.
Dan Kane,
And Kane, yes.
Matt Wason,
Matt Wason, yes.
Mike Zeldin,
Mike Selden, yes.
and Kevin Baker votes yes. Thank you all for taking the time on a Friday evening. All we need is a motion to adjourn.
I make a motion to adjourn, and thank you so much for the ID number.
Their second
Second,
roll call vote. Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane, yes.
Matt Wason,
Matt Wason, yes.
Mike Zeldin,
Mike Selden, yes.
and Kevin Baker votes yes. Have a nice weekend. Thanks, Judy. Thanks,
Nice
Shayla.
weekend.